Which of the following methods is the correct way to remove a dirty isolation gown? A. Pull the gown over the head. B. Let the gown drop to the floor and step out of the gown. C. Roll the gown dirty side in and away from the body. D. Pull the gown off by the sleeve and shake the gown out. Answer: C. Rolling the gown with the dirty side in prevents the contamination of surrounding surfaces and the spread of pathogens. It's important to handle soiled isolation gowns carefully to prevent the transfer of infectious agents. The healthcare team member who assists the client with the performance of activities of daily living is the A. Social worker. B. Occupational therapist. C. Speech therapist. D. Case manager. Answer: B. Occupational therapist. Occupational therapists help individuals regain and build skills that are important for day-to-day living, including activities of daily living, ADLs. They work with clients to improve their ability to perform tasks in their daily living and working environments. What does ambulate with assistance mean? A. Walk with the client twice a day. B. The client may use a wheelchair. C. Have the client use a cane for walking. D. The client can walk with the nurse aide providing help. Answer: D. The client can walk with the nurse aide providing help. To ambulate with assistance means that the client requires help or support when walking. This support could be physical, like a nurse aide holding onto them, or with the use of walking aids like canes or walkers. However, the given option that best fits this definition is having the nurse aide help. When transferring a client, most of the client's weight should be supported by the nurse aides. A. Back. B. Shoulders. C. Legs. D. Wrists. Answer: C. Legs. When lifting or transferring clients, healthcare workers are taught to use their legs and maintain a straight back to prevent back injuries. The legs, specifically the quadriceps and gluteal muscles, are some of the strongest muscles in the body and are more capable of handling weight without causing injury. When changing a soiled dressing, the nurse aide should wash the nurse aide's hands. A. Before the procedure. B. After the procedure. C. Before and after the procedure. D. Before, during, and after the procedure. Answer: D. Before, during, and after the procedure. Hand hygiene is crucial for infection control. Washing hands before the procedure ensures that contaminants or pathogens are not introduced to the wound. Washing during the procedure, especially between handling a soiled dressing and applying a new one, minimizes cross-contamination. The nurse aide must wear gloves when A. Transferring a client. B. Providing mouth care. C. Dressing a client. D. Weighing a client. Answer: B. Providing mouth care. Providing mouth care has a potential for coming into contact with bodily fluids such as saliva or blood. Wearing gloves while performing mouth care protects the nurse aide from potential transmission of infections. When assisting a client who has right-sided weakness to transfer from a wheelchair, the nurse aide should support the clients. A. Left side. B. Right side. C. Front side. D. Back side. Answer: B. Right side. If a client has right-sided weakness, that side is less capable of supporting the client's weight and needs additional support during transfers. Therefore, the nurse aide should support the client's right side to ensure a safe transfer. The nurse aide can help prevent pressure injuries in the client by A. Repositioning the client every 4 hours. B. Massaging reddened areas on the client's skin. C. Keeping linens clean, dry, and wrinkle-free. D. Using perfumed soap to clean the client's skin. Answer: C. Keeping linens clean, dry, and wrinkle-free. Pressure injuries, also known as bed sores or decubitus ulcers, are caused by prolonged pressure on a particular area of the skin. Keeping linens clean, dry, and free from wrinkles minimizes sources of pressure and friction on the skin. If a nurse aide discovers a small fire in a client's room, the nurse aide should first A. Sound the alarm. B. Contain the fire. C. Remove the client from any danger. D. Extinguish the fire. Answer: C. Remove the client from any danger. The first priority in any emergency situation is the safety of individuals, especially vulnerable clients. Before sounding alarms or attempting to manage the fire, it's essential to ensure that clients are safe and away from immediate danger. When a client has memory loss or confusion, the nurse aide should A. Reassure the client that forgetting information is expected with age. B. Speak loudly to the client. C. Ignore the client's statements that are not accurate. D. Give the client simple step-by-step instructions. Answer: D. Give the client simple step-by-step instructions. Clients with memory loss or confusion often benefit from simple and clear instructions. This helps reduce confusion and ensures that they can follow tasks or routines more easily. Overcomplicating or being dismissive can exacerbate confusion or distress. What does the abbreviation ADL mean? A. Ad lib. B. As doctor likes. C. Activities of daily living. D. After daylight. Answer: C. Activities of daily living. ADL stands for Activities of Daily Living. These are routine activities that people tend to do every day without needing assistance, such as eating, bathing, dressing, toileting, and moving around. Which of the following actions should the nurse aide take to communicate with a client who has a hearing loss? A. Face the client when speaking. B. Repeat statements twice every time. C. Shout so that the client can hear you. D. Use a high-pitched voice. Answer: A. Face the client when speaking. Facing the client when speaking allows the client to see the nurse aide's facial expressions and read lips, which can greatly aid in understanding. Shouting or changing the tone of voice can distort words and may not necessarily improve understanding. What is the first area of a client's body that the nurse aide should wash when providing a bed bath? A. Legs. B. Face. C. Arms. D. Chest. Answer: B. Face. Explanation: when providing a bed bath, it's customary to start with the least soiled areas to maintain comfort and dignity for the client. The face is typically the first area washed during a bed bath. When a nurse provides the nurse aide confidential information about a client, the nurse aide should A. Share it with other clients. B. Keep the information private. C. Discuss the information with other staff members in the break room. D. Discuss the information with the client's family. Answer: B. Keep the information private. Confidentiality is a fundamental principle in healthcare. Any information regarding a client's health, treatment, or personal matters should be kept private and only be shared on a need-to-know basis within the care team. Before entering a client's room, the nurse aide should first A. Turn lights on. B. Identify self. C. Knock on the door. D. Call the client by the client's name. Answer: C. Knock on the door. Knocking on the door before entering respects the client's privacy and provides them with a heads-up that someone is coming in. It is a gesture of politeness and respect for the individual's personal space. Mouth care for a client who is unconscious must be done every A. 2 hours. B. 4 hours. C. 6 hours. D. 8 hours. Answer: A. 2 hours. Unconscious clients cannot perform mouth care for themselves, and their mouths can become dry or accumulate secretions quickly. Regular mouth care helps prevent infections, keeps the mucous membranes moist, and promotes the client's overall comfort. The nurse aide should place the client's soiled bed sheets. A. On the bedside table. B. On the floor of the soiled utility room. C. In a biohazard bag. D. In the soiled linen container. Answer: D. In the soiled linen container. Soiled linens should be placed directly into the designated soiled linen container. This practice helps prevent the spread of infections and maintains cleanliness and order in the care environment. Before taking the oral temperature of a client who has just finished a cold drink, the nurse aide should wait. A. 20 minutes. B. 25 to 35 minutes. C. 45 to 55 minutes. D. At least 1 hour. Answer: A. 20 minutes. Consuming cold or hot beverages can temporarily affect oral temperature readings. It is generally recommended to wait at least 15 to 20 minutes after the client has consumed a cold or hot beverage before taking an oral temperature to ensure accuracy. To prevent dehydration of the client, the nurse aide should: A. Offer fluids frequently while the client is awake. B. Wake the client hourly during the night to offer fluids. C. Give the client frequent baths. D. Feed the client salty foods to increase thirst. Answer: A. Offer fluids frequently while the client is awake. Regularly offering fluids to the client while they are awake is one of the most effective ways to prevent dehydration. It ensures that the client gets adequate fluid intake throughout the day. When preparing to take a meal tray into the client's room, what is the most important action for the nurse aide to take? A. Check that the client's name is displayed on the tray card. B. Make sure the client's favorite foods are present. C. Determine if enough fluids have been ordered. D. Keep all foods covered until eaten. Answer: A. Check that the client's name is displayed on the tray card. It's crucial to ensure that the correct meal is given to the correct client, especially if the client has specific dietary needs or restrictions. Checking the client's name on the tray card ensures that the client receives the appropriate meal that matches their dietary requirements. Which of the following equipment should the nurse aide have available when caring for a client's beard? A. Basin, mirror, nail file, and towel. B. Towel, gloves, razor, and shaving cream. C. Shaving cream, razor, gloves, and comb. D. Razor, shaving cream, towels, and orange stick. Answer: B. Towel, gloves, razor, and shaving cream. When caring for a client's beard, the nurse aide will need the appropriate equipment for shaving, which includes a towel to dry or wipe the face, gloves for infection control, a razor for shaving, and shaving cream to soften the beard and prevent cuts. To find out what type of diet the client should be receiving, it would be best for the nurse aide to check: A. With the kitchen staff. B. On the client's room bulletin board. C. In the client's care plan. D. With the client's family. Answer: C. In the client's care plan. Explanation: the client's care plan is the primary resource for understanding the specific needs, including dietary requirements, of the client. It's created based on a comprehensive assessment and is tailored to the individual client's needs. What should the nurse aide do when a client with Alzheimer's disease seems depressed and quiet? A. Talk when the client is silent. B. Observe the client for nonverbal cues. C. Change subjects until the client begins to discuss something. D. Tell the client not to worry. Answer: B. Observe the client for nonverbal cues. Individuals with Alzheimer's disease might not always express themselves verbally. By observing for nonverbal cues, the nurse aide can better understand the client's feelings and needs. Which of the following actions by the nurse aide can best demonstrate active listening skills? A. changing the subject frequently. B. Responding when appropriate. C. Correcting the client's mistakes. D. Directing the conversation. Answer B. Responding when appropriate. Active listening involves fully concentrating, understanding, responding, and remembering what the other person is saying. Responding when appropriate shows that the listener is engaged in the conversation and acknowledges the speaker's thoughts and feelings. The nurse aide should understand that a back massage A. Causes muscle spasms. B. Increases blood pressure. C. Promotes circulation. D. Increases the heart rate. Answer C. Promotes circulation. A back massage helps in promoting circulation by increasing the flow of blood to the massaged area. This not only helps in delivering oxygen and nutrients to the muscle cells but also aids in removing waste products, thereby promoting relaxation and relief from muscle tension. When assisting with dressing a client who has left-sided weakness, what part of a sweater should be put on first? A. Both sleeves. B. Left sleeve. C. Client's choice. D. Right sleeve. Answer B. Left sleeve. When dressing a client with one-sided weakness, it is generally recommended to start with the affected or weaker side first. This approach provides the client with greater comfort and ease during the dressing process. A client with arthritis reports difficulty when cutting the food. What should the nurse aide do to encourage the client's independence in eating? A. Cut the food and feed the client. B. Insist that the client eat the meal without help. C. Assist the client in cutting the food and encourage the client to use the special eating utensils. D. Ask the dietary department to puree the client's food. Answer C. Assist the client in cutting the food and encourage the client to use the special eating utensils. To promote independence and provide the necessary assistance, the nurse aide should help the client with cutting their food and introduce them to adaptive or special eating utensils designed for individuals with arthritis or other hand mobility issues. The nurse aide is assisting a coworker in obtaining a quad cane for a client. How many legs should the nurse aide understand that a quad cane has? A. 1. B. 2. C. 3. D. 4. Answer D. 4. Explanation: a quad cane, as the name suggests, has 4 legs or prongs at its base, providing a wider base of support and increased stability compared to single-tip canes. Once a client has been pronounced dead, the responsibility of the nurse aide is to A. Make sure the body is clean. B. Call the family. C. Leave the room. D. Give spiritual care. Answer A. Make sure the body is clean. After a client has been pronounced dead, one of the duties of a nurse aide is to provide post-mortem care, which includes ensuring the body is clean and presentable, especially if the family is expected to visit. A client drinks 240 milliliters of soup, 120 milliliters of coffee, and 90 milliliters of juice for lunch. The client's total liquid intake for lunch is A. 360 milliliters. B. 450 milliliters. C. 480 milliliters. D. 520 milliliters. Answer B. 450 milliliters. To determine the total liquid intake, you simply add all the amounts together. 240 milliliters soup plus 120 milliliters coffee plus 90 milliliters juice equals 450 milliliters.